31, number 31.
Hey,
Good afternoon, sir. How are you?
good afternoon. Your name? It's Italo.
Italo, what are you feeling?
So, I have a bit of a sore throat. I have a little bit of a runny nose. Sometimes I have a fever. Sometimes I don't. Anyway, I think it must be the flu, something like that. I'm not sure about my temperature.
I'm going to stay here, excuse me. Your temperature is normal. Did you take any medication?
I was taking some cold medicine, thinking it was the flu, but it ended up lasting a few more days. I thought it would be better to come here to see if it was something more serious.
All right. Let's go then. I'm going to send you to internal medicine because right now we don't have an ENT doctor. There isn't one available at this time of day. The doctor will call your name and bring you into the exam room. I called your number. The service desk will call you, then you open your file, take it, and wait over there. The doctor will call you next.
I understand. What does this person here mean?
Your clinical priority. According to your complaint, I determine your clinical priority.
I see. It says green here. So how quick is it? Because I'm in a bit of a hurry too.
So you'll be seen within 2 hours.
In hours?
No, within 2 hours. That period is up to 2 hours. It doesn't mean it will take 2 hours. We have 4 doctors here on duty, and we have 25 patients. So in other words, within 2 hours.
25 patients ahead of me in my case?
That's right, but you have 4 doctors seeing patients. So 25 people for...
But that's a lot of people. On average, how many hours?
It depends on each patient. A patient like you will be seen pretty quickly because, based on your complaint, it should be a quick visit. So usually, green-coded patients don't have to wait that long, especially since we have 4 doctors.
But can't you put me in another category? I'm in a hurry. I have an appointment now.
Priority isn't about rushing. For her, it's a clinical priority, so I can't, no.
Do you know how much I pay for my health plan? I pay almost 2,000 Rs for it. Why do I have to come here and wait 2 hours to be seen? Like if it's something more serious?
If it were more serious, based on your classification and your data, we have the information here to put you in the yellow section. For example, if you come here with chest pain, having a heart attack, then yes, I take you to the back. We do an electrocardiogram, and then we provide care. If I come here, sorry.
What's your name? I'm Eder. Eder, right? Yes, Eder. Is your supervisor here? I need to speak with him. This situation isn't acceptable.
We have an administrative duty officer who is responsible for the hospital. If you turn near the customer service center, you'll find the administrative duty officer there. He's in charge of the whole hospital. I see. Oh, so I can talk to him there.
So I'm going to go there and file a complaint because this situation just isn't acceptable.
The ombudsman's office is just ahead, okay?
Waiting here 2 hours is unacceptable. It's disrespectful to people's time. How can you come here for care, sit in a chair, and wait 2 hours to be seen?
People leave their homes looking for care, and the hospital is full.
I'm going to file a complaint. Eder.
Is that it? That's it, Eder. All right.
I'm going there, thank you.
Oh my God, it's always something new. The guy comes here, man, with... No, seriously. I can't believe it. The guy comes here wanting to be seen quickly, marked as green, with flu symptoms. You're kidding me. It doesn't make any sense. Oh, I feel like it. Then you can file a complaint. You can file a complaint anyway. I don't understand what's going on here anyway. Hi, can I talk to you in private? Yes, you can.
There's a patient who just registered here. Did you give him a green wristband?
That's right. He has a sore throat, flu-like symptoms. His triage is green.
But look, he hasn't had any more severe symptoms. He's right there. He just talked to us in the department now.
Unfortunately, there's nothing to be done. That's what he's feeling. That's his complaint. There's nothing else I can do. There are also people ahead of him with more serious complaints who are green-coded.
Okay, I'll handle it there. Thanks.
You're welcome. Man, how do these patients get on my nerves so much? Seriously, how? So now the administrative staff comes here to bother us because the guy wants to cut in line with a sore throat, with the flu. No, I can't believe this. All right, let's go. Look, nobody's at the hospital, man. There's no one to call now to do the triage. Patient making a scene. It's 10 o'clock. Ah, I know. Today is Thursday, tomorrow is a holiday, I get it. He wants to be seen quickly, wants a sick note, I get it. That's it, he wants to take advantage before the holiday. I get it. Wow, seriously, basic human decency is really lacking these days. Oh man. But hey guys, what's up? What can you tell me? Guys, so triage, right? I'm making a lot of content about triage. For those who don't know, We have a postgraduate course that has a whole module just about triage. I've already recorded actually the 50 flowcharts, meaning I explained each flowchart according to the Manchester Protocol. We have realistic simulations of these flowcharts, all 50 of them, bringing them into real-world practice. And then the real-life scenario based on the patient's complaint, the flexibility you need to have as a nurse, those real situations that happen like arguments, people who want to see a medical certificate. So we're creating some really top-notch, truly unique content. We're going to include this in a postgraduate course on emergency and urgent care that we're developing. And besides that, we have to understand that triage is the starting point, right? In other words, it's where the patient arrives with a complaint to enter the emergency room. And obviously for emergencies in the resuscitation room where the most critical patients arrive, what did we actually create? We created an immersive resuscitation room training where I'm going to cover 4 important topics for any situation that comes in, okay? And generally, these situations are about assessment and management of the patient in the resuscitation room. In other words, what do I do when a patient comes into the red room? So there will be an immersive training on April 11th. I don't know what day you're watching this video, but on April 11th, 2026, we have an immersive training, and during that training, it will be from 9 a.m. to 5 p.m. And the first stage will be in 4 blocks. The first block will be the assessment of the patient who arrives in the resuscitation room. What do I do? How do I delegate to the nursing technician what needs to be done? What do I do as a nurse? How does that workflow operate there? Second block, I will work with chest pain, which is, it's classic for patients to arrive with chest pain. And we notice that most people don't understand the chest pain protocol, much less the heart attack protocol. What should be done? How do we understand this flow chart? So we're not only going to explain it, but also give practical demonstrations of how this works, how this happens in daily practice. Third part, the nurse's leadership during cardiopulmonary resuscitation cases, because this is extremely important for them to understand both what to do and how to delegate to the team. And since I'm talking about the resuscitation room, that's where CPR takes place. And finally, we're going to work with arrhythmias, which happen quite often, right? Tachyarrhythmia, bradyarrhythmia, ventricular arrhythmias, the malignant ones. So we're going to work on that and cover the clinical management because these are truly the emergencies that come in quite frequently. So this all-day immersion, we already have a lot of people who have bought tickets. It's going to be awesome. It's going to be live. And there's the possibility if you can't participate live or can't be there 100% of the time, you can watch the recording later. For that, there are separate tickets. There are tickets for the live event and tickets for the recording. Nice. As this recording for you to watch and review several points that we will work on here. I'll leave the link here in the description. If you're watching this video in time, sign up. It's going to be really good. It's exclusive for nurses. I'm sure the learning experience will be unique and it's going to be really good. I'll be waiting for you there, okay? November 11, 2017.